Okay. So roll call. Artis,
Here.
Don,
Here.
James,
Here.
and Jess will not be here today. Mike, Pam,
Here.
Pete,
Here.
Rod,
Present.
and Rogers will not be in today.
Right. I have a.
Do we have, I don't see on here, maybe it's under environmental health, since the commissioner's decision on where that project stands, is that, I don't see that on our agenda.
On the agenda, I can talk about that. You can remember comment.
That's kind of rough.
Okay, all right, I mean, I think that you have to speed on that decision and hear that.
I'll make a motion to approve the agenda.
Agenda is approved. Citizen comments. And, that's for submitting. Anybody here like this? Anybody like to come forward and address?
My name is Jennifer Tipton. I'm at 123 Crabtree Lane. And I just had a question about on page 17 of the environmental health report. And I know you guys are going to talk about it, but I was just wondering if I could get a little more clarification on that's the groundwater monitoring by year and zone. I was just wondering if when you come to that on the agenda, if you could explain more about the districts and what that monitoring is for, what it's testing for, if it's what the intent of it is, if it's analyzing the impact of density of septic systems, or where I could find out more about what exactly is being tested and where I can find out more about that. And I'm also, I also would like to say that I am very happy with the commissioner's decision about the septage ability. I think that was a wise decision to take a harder look at that before spending 1.5 million on a property that isn't worth that much. So thank you.
Okay.
Well, whatever you think. I mean, if you'd like more information about groundwater monitoring, I would suggest you go to the Department of Health and just have a discussion with our director over there, and he can explain how all of that works. It's more for septic installation, and they do groundwater monitoring for that. So James Wardinski in the back of the room, and environmental health just across the guy here and on the left.
Would I need to make an appointment?
What's that?
Do I need to make an appointment?
Yeah, you can check with Jim. He can probably get you in whenever we over there. That should ask that.
Anyone further? None. The approval of the minutes, February 16th. Motion or second. Receipt.
Aye.
February 6th. Next. Public meetings that I've any years. I've got that whole been here. So meets.
I was surprised that we didn't do person. I would favor of doing it. I think the fact that we are, some of us appointed, was elected. I think that it's a good reminder of who we serve and why. I absolutely.
I'll give a comment. So I'm leaving. So I have some more to say. But I mean, there are some people who are uncomfortable. Who both are on what maybe we consider the left side and the right side, who just really don't feel comfortable making such an outward display of patriotism, and would rather let their actions do and their service do display their patriotism rather than such an outward sign. And in a time of division, I think that why add something that's going to potentially the division may take and who may choose not to. So I would recommend that we not do that and we continue important matters that are.
And for them, what,
So when I first became commissioner back in 2000, found it interesting that the commissioners didn't have an American flag in the chambers. And I guess I kind of I took it. I just said, well, we serve the public, we're part of America, it's who we are. And so I wholeheartedly support allegiance, because after that day, we did start doing the Pledge of Allegiance, still do the Pledge of Allegiance. No, if that offends somebody, I'm sorry, we're America. It's the Pledge of Allegiance to a country that I. Anyway, that's me. That's just, I'm for it.
you went further? I agree totally with you. I would like to further dissension that.
That was an action item on there, or can we just do that?
You know, it's not anything that,
Huh?
I don't believe you need to do that as an action item, because it's something that you guys are, I don't.
Yeah, I'm. Or in the Cold War. Honest dissent, I believe in arguing. I believe in all of that stuff, and I believe that we set a good example. And we should set a good example. I'm sorry, does offend some people, I know it does. I probably have some friends, and maybe you do too, that, but at the end of the day, I think one of the things we're lacking, perhaps lacking not in totality, but at least in pocket, a certain amount of discipline and a certain amount of respect. And when I grew up, and I think that all of those that served in the military, I have a very good memory of the military, not a bad one, because it took a kid that had no direction and gave me direction and made me the person I am today. And I think that is a very significant event. And I think that from that standpoint, yeah, I'm all for it.
My concern is that I don't want anybody who would choose not to take in this board looked down upon or to chastised by the public or in way as being as being unfit to serve just because they play patriots.
And I am. I think by allowing. No. Certainly. Certainly. And that, certainly say saying that they want to say something. So it's a matter of whatever. All right. Next, we are reports.
Last name. Luckily for you. Chairman, members of the board. 2 items to report on today. First is to introduce you to your new manager of your Monmouth County Animal Shelter, the next.
Well,
Nice to meet you.
You want to tell them a little bit about yourself?
Okay. Big week here. Been up here for about 1.5 years, my whole in Longview. I agree with administration. Here for the last 15 years of experience in general. Love it up here. Mary's got 2. Never need anything.
Welcome aboard.
Thank you.
The other item is had the pleasure of reporting to this board for the last 13 years. It's been both an honor and a pleasure, and had a lot of great support and good help. I appreciate that. And 13 years went flying by. I'd just like to say thank you for the opportunity, and I live in Lakeside. I'm easy to find and available. So my wife has a lot of plans for me. Get me out of there. Thank you very much for everything, and I wish you a good afternoon.
thanks.
Thank you.
Right, next community health.
Good afternoon. Those of you that haven't met me, my name is Jillian Bull. I'm the community health nurse supervisor downstairs. Just returned from Fremont. So getting back into the swing of things. So it's nice to meet you, Dr. Maharsky and Jim. And we'll miss you. Okay, so just a couple updates from what I'm aware of. And so for WIC, so they started seeing patients beginning of the month, and so far it's going well, and we'll be reporting on that more next month or for March. Staff are currently working on their LCLs down in the immunization clinic from a follow-up at the last Board of Health meeting. They talked about the jail clinic, and so our immunization team did collaborate and work with the jail to provide and offer immunizations to inmates. We used to provide this years ago and then kind of paused it a bit. So we had a success. We had 2 RNs go over and vaccinated 15 inmates, and 37 vaccines were administered. The vaccines that were offered included influenza, hepatitis A, hepatitis B, HPV, Tdap, pneumonia, and COVID-19. And we'll just continue to be collaborating and offering this service to our inmates every quarter. Any questions on that? And then the other update I just wanted to note, almost 6 months ago, we began offering COVID PCR testing, and we received supplies from the state. That supplies is now expired. We looked at getting supplies costly, and our demand is going way down because not a lot of places require PCR testing anymore. So we're going to hold off on that service right now. If demand increases, then we can still offer rapid. Your community health. Yeah.
We had health report. Is there a question that you give them later to?
So, I mean, with everybody who comes in, of course, we're assessing if they've ever had anything before, but prior to getting it, we go over all the adverse events and they get a vaccine at every visit. But if they did experience an adverse event, they are encouraged, which is discussed and on the BIS information sheet, to report to the VAERS vaccine adverse reporting system. They can self do that, or if they called in, especially since if we were the provider offer administering it, we would report it depending on maybe what those events are. We would encourage, depending on what the event is, if they need a follow-up. Hope that answers your question.
Yeah, absolutely.
They can report to VAERS on their own. Yep. Yeah, you're welcome. All right, thank you guys.
So I'll have Lisa come up. So we just got the transmittal back from HR today. And actually right before this meeting, and Lisa is our new population health manager. So I'm stepping back from that role. Just because I was doing dual duty, but Lisa has stepped into that role and truly appreciate it. So population health
Excited for
manager.
a new adventure.
Take that.
Good afternoon. Looking at the clinical disease report, and for the trends for the influenza cases and hospitalizations and we are continuing to see kind of that downward trend for hospitalizations and cases related to influenza. I know there were some folks that were interested in the vaccine percentages of those folks that were hospitalized for influenza. I didn't get a chance to get that on the report, but just kind of a verbal report off for this season. Approximately 6% of those hospitalized this year were not vaccinated against influenza. And about 23 were vaccinated, and about 17% had a vaccine status that was unknown. So, but that's kind of the outline for that. And then I know I did include the comparison chart for various influenza seasons a couple months ago, and I just thought it'd be nice just to get it again and kind of just see where we've been headed with our influenza here. As you can kind of see in late January, mid-February, we kind of had a little bump, kind of similar to what we've seen in previous seasons, granted on a very smaller scale. Again, that trend is going to go down. And then I also included the last minute, sorry about that. Janelle was kind enough to upload this outbreak information this morning. I included just kind of a synopsis of what our team's been working on, specifically Taylor and I'm here as a congregate care living prevention specialist with outbreaks. So looking at the various pathogen caused outbreaks so far, beginning January 1 through February, and then looking at the different facilities that have been experiencing outbreaks. So if you have any question on that, it's been a very, very busy year starting off, and then March is not any different. I think this includes 20 different outbreaks. And so far for the month of March, it's been, I think, up to 18 outbreaks just this month so far. So we're up to about 38 outbreaks this season. So Taylor's been doing an amazing job with overseeing those outbreaks and reporting the information. So I'll make sure to include this information for next month as well, so you guys kind of keep a finger on the pulse with that. And then norovirus is rearing its ugly head. So far this week, it's been a pretty active week. We've had a couple facilities with norovirus outbreaks, and based on the information that we're getting from our surveillance partners and just the community, norovirus is kind of running around. So we're working to get some information out to our providers, the facilities, daycare facilities, and just into like social media, just reminding folks what to do if somebody becomes sick, how long to stay home for, and cleaning and whatnot. Are there any questions on the report?
I have one question on the communicable disease. We talked about it last time, the lead poisoning.
Oh, sure.
Is this one that we got a hit in February? Was it?
It was an adult.
It was an adult.
Yep, it was occupational related.
Okay.
Yeah.
The comparison. If I read that correctly, had earlier
Is that a nationwide experience or is it effective or?
No, I think, not quite sure of the rationale, but I know that the Southern Hemisphere, specifically Australia, we kind of mirror what they have, because they're the season ahead of us, and that's exactly what they saw in the Southern Hemisphere was a very abrupt and sharp increase in the beginning of the season, and then it tapered off. And Dr. Hyborn, thank you so much for everything that you've done for us and your guidance and support this last few years. We're really going to miss you. So thank you so much for everything.
Thank you.
Thank you.
Family planning.
Good afternoon, everyone. So it was a pretty standard month in family planning. Numbers in February look a little low, but it was a short month, so that was to be expected, trended pretty closely to last February. 6 months ago, our providers got a dispensing license, and we had our first surprise site visit from the Board of Pharmacy last week, and we passed with flying colors. So that was exciting to see that what we're implementing is working and we are in compliance. Also, we've noticed some trends in new patient visits for January and February. Typically, we sit at about 30% of our patient visits are new. And for the past 2 months, they've been trending around 45, 48. So I think our outreach efforts in January, where we met with almost 1,000 folks, is really paying off and getting people into the clinic and aware of our services. Syringe exchange, we did distribute more syringes than we gathered. But that's mostly due to the new participants in our program. We saw 12 new participants last month enter the program, and when they enter, they typically don't bring new syringes because they haven't received it from us yet. So that number is a little off because of the high number of new participants. Any questions? Yes, sir.
Working daily. That's. Do we keep track at all? That participate in that rather than.
We do internally, and I'd be happy to report that. So we have a database that 360 is how we report to the state. Every encounter we do, we have a unique participant ID, and things from demographics, risk factors, referrals, items we gave, how many they gave in. So we could easily report that data to the board if you would rather have, instead of visits, you would want unique participants.
Interesting, just that particular conversation. One person. Do everybody who come in personally, or do people? Sure.
So ideally it would be personally, but once we give someone syringes, we don't know if they're giving them to their friends or not. And there's nothing we could really do to control that, but they do bring in sometimes other people's syringes, people who are comfortable doing it themselves. So I just want to make sure I understand what you want. So instead of saying 44 visits, or we could keep the monthly visits on this spreadsheet, you want to know unique participants as well.
Maybe I'm missing.
Just have a bar graph
There's
right here. and it's-
The graph down is syringe exchange visits. So that's the number of visits for the syringe exchange.
Okay, so you don't need unique participants, number of visits is. Okay, any other questions? Thank you.
Thank you.
Well, the mosquitoes are coming out already. I'm Brock Bull, lead mosquito tech for. Couple quick updates. We're in the process of interviewing seasonals right now, so we had a couple applicants, one in which we are hopefully in the process of hiring. seasonal position. That, during the off season, we acquired another mosquito truck, which is the big program. It allows us to have a backup vehicle. Fails on us during the season, and this particular one will be used as a fogging site. Over the winter months, we purchased a second London Fog adult side sprayer. Really exciting. That allows us to be out with 2 vehicles on nights that are best for fogging. So for that. And then as of right now, we started inspections already, believe it or not. We have some sites in Lower Valley that are melt off little by little. Soon, patch. We're looking for the eggs right now. Currently, we have just under 100 sites, and those are spread. It spreads us pretty thin, so we're out once again this year. And we're just excited to get out of the office. Any questions?
Yeah, the drone, are we going to utilize that or are we scrapping?
I'll let Brock talk to it.
Yeah. So after it was shot down last year, I decided to scrap that program. It does, having a drone, it does come with a lot of financial responsibility. And then it comes with a lot of training. And then looking at our track record, we didn't have a good track record. Most times we get out the different software that we had with the machine, a lot of times wouldn't correlate in which we wanted it to. So as of right now, we're scrapping that, but that's not to say that. Thank you.
Yeah, thanks. Oh, I'm Jim Wardensky with Environmental Health. Couple of things that I wanted to highlight on what I shared. Information wise. Right now, our groundwater pretty much. We currently have 78 groundwater monitoring sites in 6 different zones. Each of those sites can have a number of pipes, so the total number of pipes in those 78 sites is 200. So each of those pipes require environmental health staff to at least go out and check on this month as the season progresses. So there's a tremendous amount of time that goes into that. I think we mentioned that because staffing and volume of work went away from monitoring what we call where we're required. Right now, that's on the applicant. The weekly. We have a meeting tomorrow with various stakeholders regarding web-based permitting system for open burning and air quality. That's been an ongoing process, and collaborating with the county attorney's office and NRC and the fire folks and environmental health, that we can get fire parts. We recently interviewed a candidate for a sanitarian vacancy. We're encouraged by the applicant. The one thing is that the applicant is not currently a sanitarian. So what that means is, in the event that that person was hired, they'd have to go through the application process with the Board of Sanitarians through the state.
They evaluate all their credentials. And if everything goes smoothly, then they would start a sanitarian and training program, which can last up to a year for their examination. Then they would be a full. As an example, Jake Rubo, one of our environmental staff, used to be mosquito, set a record pace, and he got it all done in 5 months. Went through the process, did the training, took his examination, I think the end of February, and passed. So, that was phenomenal and super helpful. Kind of a unique little project that some of our food sanitarians are working on. They're participating in the paper test with a couple of sellers who sell beef. And because of a concern that arose, I think last year with salmonella in some of the backyard flocks that we had here. What they're going to do is where the chicks are housed, they're going to take samples, samples from the underlayment there, and submit that to the state lab for testing. See some distinct advantages, in that conversation internally in environmental health. The question I was asked, what does the retailer benefit from? Why would they participate? The easy answer to those questions, one, it's a preventative measure. So if they identify that they have salmonella, address that with vendors that are providing both. And then secondarily, perspective, working with us, tips on how to mitigate some of that. We had a planning meeting here recently with a bunch of the stakeholders involved in Under the Big Sky, and it was very encouraging in those conversations to see all the previous efforts from everybody really, and how it's smoothing that process out. Some of the things that we've learned, mistakes that were made in the past, expectations that have been conveyed for the future. And I think that's all. We had recent conversations, information has been from us about the annual food truck festival that will occur in June. And food sanitarians were a little nervous because the information they got is they're going to have 40 different mobile vendors there, which is great, but it's double. They had 8 last year. So maybe 2 days of inspections rather than for them, depending on how that works. We're working on budget stuff as everybody else is. And then one of the other things that came out of that Big Sky, Under the Sky conversation, and that was brought up last year as well, is the talk about temporary. Just in the infancy of kind of visiting that stuff and trying to figure out what steps to make sure that if that is allowed, if it's something that will be permitted in the future, how do we accomplish that to make sure? Last thing I would say is I'm sorry for all the stuff that I submitted. However, I took back from the last meeting and you said love data, so I thought I would supply a little data. Probably the bulk of what was submitted was some of the maps for the groundwater monitoring. So I thought it's nice to have those numbers. However, if you're not familiar with where the zones are for groundwater monitoring, this way the map will show you 1, 2, 3, so forth. You can look at the numbers, quote that with the areas that The other thing that's interesting to me is when I looked at, into the trends with, applications and inspections and all that. Somebody that's lived here for a long, long time, and used to be in the construction industry, I knew that there was kind of valleys with that throughout the years. That exactly shows. So very interesting. Question.
I do have one.
Yes, sir.
There is a water monitor completed, but they're in an area that is still inundated. Is talking about March. Get that in before you. Can you allow those folks to that snow?
We can, and, again, that's some of the stuff that we talked about with those dates. You know, on for our forums and website, some of those dates, been a little bit problematic. So internally, we've said, you know, if somebody wants to start groundwater monitoring, after March 15th, that's fine, we'll accept the application. However, all of the staff has been advised, if it's you that's receiving the application, please give the admonishment to the applicant that you run the risk if you don't catch that 2 weeks before peak and then 2 weeks after, there's a possibility that you'd have to monitor. So, you know, the other thing that we've encouraged people to do over the last year is put that we don't have to worry about this. There's little things, guidance that we're giving, you know, as far as putting caps on the top of your pipes. One of the things that has not commonly happened in the past, because to wherever they choose to rate it, pipe, when they install it, you know, the 8 feet below the ground level, the first foot below the ground level is not supposed to have things. And of course, that way already. Another thing is that I want to check on orifices that are in that perforated pipe that you buy. I think are bigger than what they're suggesting. You know, essentially, in my mind, you take a Sawzall or a slots, which are less, you know, or you know, if they want to wrap the stuff, so they're not getting dirt in there. So there's some helpful hints that we've been passing along to folks to try and increase. But yeah, absolutely. If you know it's buried in snow and they don't have any way to remove the snow and they want to start monitoring after the fact, with application. But you know, with a heavy admonishment that missed the peak, you know, you have just wasted a lot of time and money, and you may want to.
Yes, sir. Pardon me. Required.
It's dependent on the location. So it really, you know, some of it is learned from experience with our staff that have been out there and evaluated these areas. Some places historically are just known. And some of it comes from. So as an example, as strange as this may sound, I had somebody call in and they were asking, do I need to groundwater monitor? And so as we talked about it, and the staff, they were in Hungry Horse, downtown Hungry. And they said, Likely not, because it's such gravelly soil there. We've never had a problem with that. Conversely, places in Martin City are groundwater. So, it's kind of a case like however, times regionally or in an area, you kind of know that things are prone to that. Additionally, if you're close to some kind of land or surface water, things like that, then I'll probably.
One quick change, you mentioned at the beginning of your report, air quality burning season. I did want to point out, just because I double checked this to make sure, was that the air quality monitoring website has been updated. Correct? Was a change from last fall. So,
Or air quality.
the state of Montana air quality monitoring has been updated from the old website that they had and they had a very nice update in there, and they switched the units of measuring from that PM 2.5 to the air quality index, which is really nice because that's the same index that so on everybody's phone. So you can actually look at so that should correlate pretty nicely, because before they used your phones would give an AQI, but the states. It's a really nice website that they have. Going to be helpful, I think, then making those determinations. But then, more importantly, too, youth athletics and things like that in the fall to give.
No, great point. And one of the things that happened just this week is we had 2 staff members that attended some online training with DEQ and their air quality folks. We had been reaching out to them continuously, trying to ask about training and information that would make us more in our portion of that equation. And because of staffing levels at the state, they were slow to respond, but now have, and I think that we're integrated with them. Devin and Kevin in our office primarily deal with their quality stuff, and they were explaining that based on some of the training and the resources that have been made available, they feel more confident in their forecasting. Thank you.
This is the finance report for February. Just really, the main item, budget updates. We've got a tentative budget that's been put together. Very budget. So we're gonna probably shoot for April 6th as a meeting time for the finance committee, or what works out. After that, we'll take any information that we gather from that process and we'll incorporate it, bring the budget back to the April meeting and get a preliminary approval on that. After that, the budget approval will head to the commissioners early May. And that will take it out of our hands at that point. Really all I had. Things are on track. Balance was about 1.3 million for February. Oh gosh. So I just wanted to say thank you, Pete. Appreciate all your help. Guidance. Excellent.
Well, everybody talked about all the stuff I was going to talk about. So I just want to welcome Austin and Lisa to their new roles, and we're excited for that. And thank you, Cliff, for everything. I know I thank you all the time, but thank you for your service and making the shelter what it is. And it's truly appreciated because it's a beautiful shelter. And if you guys haven't had a chance to tour it, please reach out to Cliff the next week and Austin, or just Austin after that. But we do have a wonderful facility and have a lot of, we adopt out healthier animals than we ever did. That's kind of the ultimate goals. The Under the Big Sky, I concur with Jim. We were at that meeting. They are it's light years away from what they were last year when we had our first meeting with them. I was actually quite concerned last year when we met with them about how it would go. So they have worked pretty well with Danielle and Crystal, and now Danielle and Fred and Jim to be in compliance and to not be applying, you know, gray water to fields that people are walking through. That's it. So so there it's going well out there, and they seem a lot more organized and more receptive of anything that we had with them. So the big news that I have is that the co-responder program is going to come under the health department. So where it has been, it was with Western Montana Mental Health, and then we transferred it over to Greater Valley, and now we are transferring it to under the health department. The reasoning is we met with law enforcement, we did meet with Greater Valley. The model that is being run does not really fit with how Greater Valley does things, but it is the model that works for law enforcement. By us moving this program under us, we will have a licensed clinical social worker who we will have a contract with. They will be doing the response, and we'll eventually get a what is it called? Care coordinator to help with the licensed clinical, and it's the goal is to have 2 co-responders is the ultimate goal.
Responders and the care coordinators.
Correct.
3
That's what it's.
full-time positions.
Correct. That's what it would be, the event. That's the eventual goal. Under what we've had, we've only been able to fill 2 of those roles, the licensed clinical social or co-responder and the care coordinator. The care coordinator at Greater Valley, she did resign and move on to a different position. So currently we only have the co-responder. But us moving it under the health department, it also will allow law enforcement to be able to utilize her services, or this individual service, whoever individual licensed clinical social workers services in the jail. So it will help out the detention staff to be able to do some evaluations there, as well as be able to respond with all 4 of our law enforcement entities. So we are letting, after talking to David Randall, we're letting the contract run out March 31st. We did meet with Greater Valley and let them know, and I think they're okay with it. They're on board. They're going to be a referral service for us. We'll still do our referrals, so we'll still have a working relationship with them. But I think this is the best fit for right now.
And how is that? And then they're granting that?
There,
We take over that grant.
we have the grant.
We have. the
So
grant
we've always
already.
had the grant,
Okay.
and so what we've been doing is paying the other entities to run it. The state is working on the payment systems of how they're going to do it in the future. Right now we have, they've extended the contract to June 30th, and then they'll let us know how the grant will be run after that. There is some thoughts that, you know, that might get extended out even further because they're still figuring everything out with what's happening in the legislation and going forward, but that we administer.
So no. Answer that, and there's enough money. Paid.
Correct. So that is the biggest news I have. And thank you, Pete, for everything. It was not easy being a board member through the last several years, as some of you well know, and we appreciate your guidance and medical background and just, you know, providing facts, and really appreciate that, and we'll miss you, and best of luck in Michigan. Yep.
So at this point, I would like to. Yeah, let's do this and, at the training. And, with Walter. On. First, we're gonna. Russell. Like environmental health. Everybody that.
Yep.
That's that. 19. On that. That one kind of.
No, I don't.
Well, even last year, we did returning to the ad hoc. I don't think that's necessary.
Okay, that will be stuff. Home. Right now. And,
We no longer have home health.
Sorry?
We no longer have home health. We disbanded home health. Remember, we sold it this last, or not sold it, but closed it. This last, dissolved it. Yeah.
So that's struck too.
Yes.
My community still being.
You can't replace your teeth.
All right, so now we're down to the Budget Finance Committee and the members are Pam, Artis, and Todd, both chairman.
Yeah. Oh, he must
think
be
he's
under
looking
the
at the
other
old
one.
You're looking at the old one. There, you.
I got Jim over here.
Maybe, but I haven't had an opportunity.
There you go.
There it is.
Go off of mine. How's that?
Oh, so this is all squared away, we don't have to go.
That's
around.
We can just ratify this.
Is that
If everyone's good with this,
good? I'm good. Anybody else?
done.
And Joe always, he might have been on him, but he's just always there. So myself or Keelan will always be at one of them. So I don't on him. It's just our job to be there.
Okay. Have any committee meeting be held?
We will be having a budget finance committee meeting. That's what Kirk had talked to. We're planning for around April 6th. And then, you know, that environmental always kind of pops up with what Jim has, if there's any variances or anything. So I don't know if we know anything. We may have to meet about the burn stuff. Yeah.
Okay. All right, moving on. Board member discussion.
Yes, I can start. First wonderful. That is coming back to this. It's very much needed work. And I hope in the future.
That's our hope.
It's
Yeah.
such a huge thing. It's just a great help. Welcome us. Or to meet you all, you know, someday. Fair warning. Yeah. Been here about the same time. Unfortunately, you're gonna go away and I gotta stay.
More fun.
Thank you, Cliff, for what you've done down there. You've done a great job. Pete. Thanks for kind of holding down the fort here for us. These last few years have been quite crazy, but I thank you for your service to the Lord. And I wish you all the best. Have a go. So there was a vote taken Tuesday. And the vote was for the purchase of a property. And that went down. So this is not the end of the project. We're gonna keep working on it. We still have our money. We still have all the staff has been meeting this week. The commissioners don't get involved in that. Our staff and our administrator are meeting with HCR to come up with the next step. So we're just regrouping to figure out the next step here. I don't know what that is yet. I don't have a report yet from those meetings. But when I get that, I can share it. But we all know what's sorely needed in the community. The facility is something that we just have to make happen. So we need to do that. And that's been my message. Can't speak for you. Been my message the whole time. This is something have to have to protect our water quality out there. So I think we're gonna be fine. I think everything's good. We just have to remove. I don't know what that looks like.
That question, yeah, so my understanding, reading the reports was not that that your colleagues were opposed to that particular piece of land. It was more than, it seemed more opposed to the project in general being public. Is that true, or was that your vibe from your fellow commissioners?
I think for one of them, yes. I don't think the other one felt that. Yes, sir.
Did we fail, somewhere along the way to keep the
And everything that all the rest of us knew, they were very well informed. We did get a business plan a little bit late, because that's why we had those extensions, business plan. And that took a little longer than we thought it would. We did get it. We got it, I don't know, it was probably 5 days before we actually got the final, but we had seen a lot of drafts. So we kind of knew where it was going, but we didn't have our didn't change a lot through all of that. There was a little bit of stuff going on, but it's what it is. Any startup is going to have some money upfront cost. You're going to have to, anytime you start, it's like anytime you start a business, you have upfront costs. As soon as you open your door, you have payroll. You may not have income. So you have to have that capital to get going. Once you get going, then the projection out, but it's the initial startup is always fun income. But at the end of the day, it will be self-sustained. It will be able to make money. I would say substantial. We'll see. They'll control it with tipping fees. And then it takes about a year or so to get the compost to where they can sell. It's got a study. So that'll come a year later. But at that point, then they'll be well established and they'll have a should help them. This is not necessarily about creating a very proper. It's more about taking care of the environment. So we will remain the owners. Because it's ARPA funds, remain the owners, we will contract with someone. Don't know who that, before I go out for an RFP. The process and see who wants to actually run it. And again, it will be all about the and providing a service that we really need here at Borough. And frankly, it's the first one in the state, so I think we're well ahead of most of the other places. Been one for a long time. Page for others. Thankful that we have the money, because that's the huge part of this. That it allows us to actually be very good for our community. Yeah, it's a great project. I don't know if you can tell, but I really like it.
There's no, and what's the sunset on those funds?
There's no sunset.
No.
We can keep going. It's like 20. There is, but it's out there. Remember that date. We're gonna be good. After
The 2025, I think
it's
it's
25 or 20.
it's 2025 that you have to have the project well underway, and then 2026.
Any other questions?
is it? Able now.
I don't know.
Can I make
I
a
don't know.
comment about? You talk about this being good for the health of the community, but I don't know if everyone else realizes.
Yeah, I'm sorry.
It's just between Lakeside and the county, they're placing my family farm encircled with human lakes.
No, that was it. It's sorely needed and we need to move forward with project. Don't know where it's gonna be right now again. That's what we got.
From a city's perspective, the way locals trying to keep our sewage in. Containment. Going in second. That's. There's no question. How much a percentage of this? Have septic. And if they don't, I'm trying to grapple. Land out. I don't take care of the existing septic system right now. In there. You know. My my point in the city or whatever.
Thank you. Thank you.
Okay, that's.
I'm good.
I'm good.
Had the opportunity to meet. Purpose, purpose, I'm lucky to have such. Pete, sorry, I didn't get to. Our guest around, but a very academic issue. But
Really don't have any high volume down.
Thank you, everybody, and thank you to all of you in the health department. I have nothing but the utmost respect for everything that you do. Sometimes the community underappreciates the benefit and the service. So, thank you all very much for it done, and I'm on the board and I'm happy.
No business done before this.
I'll make a motion to adjourn.
Sure.